Hi, my name is Mackenzie Pyatt. I'm here with Kevin Gillespie, who heads up a growing family of health and community development enterprises, including integrated services for behavioral health. We'll talk about some of the changes we are all starting to notice related to healthcare reform, requiring a more collaborative practice with healthcare professionals more as partners. Common sense maybe, but not really the way our current system of care has been designed. So Kevin, why don't you tell us a little bit about integrated services?
Well, Mackenzie, I'd like to tell you a little bit about integrated services, and in doing that, I'll kind of open the door to this conversation about switching away from focus on disease treatment to supporting people to take care of their own health. The entire healthcare system is in the early stages of changing that focus. As for us, integrated services for behavioral health, we've gone through a lot of name changes. We started supporting families that are referred by, and we still do this, that are referred by children's service agencies. And we did a behavioral health style of family preservation service for many years. Since then, we've grown to become a comprehensive behavioral health company with, the usual psychiatry, counseling, but still our real core service is community-based, home-based services, community behavioral health workers, we call them. And so that's mainly what we do. Recently, though, we've created we're a nonprofit company. Recently, we've created a community development company and a care coordination company, but all with the idea that healthy people and stronger communities are really the concern of people themselves and families and communities. And treatment only has an important role, but not the main role. And in our instance, the two high frontiers of our own development is the integration of behavioral health into primary care and managed care itself, switching away from a fee-for-service system to a managed care style of payment system.
So tell me more about Integrated Community Enterprises.
Integrated Community Enterprises is a new limited liability company that we just created. It has a separate managing director, though it's an integral part of integrated services for behavioral health. But Integrated Community Enterprises works solely on community development with a focus on affordable housing, but with other enterprises related, for instance, to food stability in communities. I'm aware of a county not too far from here that does an entire county, rural county, that doesn't have a grocery store. Well, that's a pretty serious challenge to health. And again, we're talking about people managing their own health concerns as being more critically important than treatment services. It's a fairly radical idea. But if you're, for instance, if you have diabetes in part of your presentation to a primary care physician, well, not having a grocery store in your county is a problem. It's a very big problem because you do have a store that sells inexpensive, high sugar, high carbohydrate products, but you don't have a wholesome, you don't have a good supply of wholesome fresh foods. So we're doing community development, for instance, so people can work on their own housing stability issues, food stability issues, and another thing that Integrated Community Enterprises is working on is an early college concept in collaboration, early stages of development with Ohio University and other community partners to create an early college that's especially designed for first-generation college students, whereby the last 2 years of high school and the first 2 years of college are combined. So, and in addition to affordable housing, that's what Integrated Community Enterprises is working on.
So can you explain the role of health priority coordinated care?
We're intending for it to be a managed behavioral health organization. Will evaluate the effectiveness of the behavioral health services that we do.
Thank you so much, Kevin. For more information on the new practice of health, you can visit integratedservice.org. Thanks for watching.